everyone, welcome. My name is April. I'm here with Pacificos Aesthetics. I'm here with lovely Kristen Crawford and Lisa DeLacy. We're going to be going over we're going to be doing an interview with them because they've completed their DIVA treatments, and I'm going to be giving you some information on the DIVA. This is a first of its kind, basically breakthrough treatment in vaginal laser resurfacing. And my passion comes from women's health. For 20 years, I did deliveries and helped women with pap smears, menopause, birth control, all kinds of other things. And I realized our limitations with helping women are significant. And when women are aging, it's not just an issue of more mature women, it's women of all ages. And this is something that the DIVA is basically the first of its kind to actually address several issues for women. So indications for the DIVA are basically laxity and dryness that can happen with hormonal changes, even premenopausal, but definitely postmenopausal, which lead to pain, difficulty with intercourse, recurrent bladder infections, and also other types of infections, yeast infection, bacterial vaginosis, and also women that have gone through hormonal changes for a variety of reasons. Childbirth, obviously a very significant one that can cause pelvic floor laxity, scarring, and lastly, women with cancer. And sadly, this is affecting a lot of young women this day and age who've gone through chemotherapy, radiation. And so this life-changing procedure is really something that we're trying to get out to the world, and brought these two ladies who really bring a lighthearted approach, and we'll share their stories with you and showing how important this is. A couple things that, basically were offered in the past. All we had were estrogen creams, which not everyone can do that, and creams are not fun, or surgery if you have pelvic floor laxity. And not everyone's a candidate for surgery, nor do they want to do surgery. So if you have mild to moderate incontinence, this may be an amazing option with very minimal downtime. And all these issues we just discussed affect your quality of life and your confidence. And whether or not you're a single woman or a married woman, whatever is going on in your life, whatever age you are, something like 80% of women suffer from one of these symptoms. And again, one of the things that just really kind of lit a fire under me, I was watching TV. I don't watch a lot of TV, but there was a commercial for Men's Health, and this guy, Frank Thomas, was given a testosterone supplement. So he's in his 60s, looking all muscular, and you're having a better sex drive and relationships, and you look better and feel better. The next commercial was this younger woman who's got a baby. She's a professional. She's trying to get out the door, and she's got some mild incontinence. What was their answer? Poise pads. And that is unacceptable. So we're trying to bring some knowledge to women, knowing that there is something else that you can do to really change the quality of your life. Just to go over a little bit about what's involved with the DIVA, it's a series of 3 treatments, 1 month apart. You come in and we do complimentary consultations. We do an exam to make sure you're a good candidate and make sure your symptoms are appropriate. If symptoms are severe, we also can guide you as to where you can go and what you can do about it. And once you're going to do your procedure, we have you come in, put some numbing cream in for about 25-30 minutes, very comfortable. And then we start the procedure. It's literally a 3 to 5 minute procedure. And you are numb, depending on what your issues are. And these ladies will describe their experiences. You will feel possibly some discomfort at the very end, but it's basically a tapping sensation that you feel. And afterwards, our very first patient that we did, she was an ER nurse. She literally went off to the ER and worked a 12-hour shift, no problems, which is absolutely amazing. We use a sterile quartz dilator that is a disposable. So it's 1 per person per treatment, gets thrown away each time, and nothing is moving inside you. Any of these older treatments, things are constantly moving. It's basically the provider has to do things right. This is all computerized. So you just hold it in place. And the dilator sits there, and the machine does a perfect 360 delivery of the energy. Nothing is going in or out of you, which is amazing, and that contributes obviously to your comfort. Afterwards, your downtime basically includes maybe a little bit of spotting. You should be very comfortable, have no pain. Some women will get a little itching as the tissue is healing. So we have people just use a pad for a couple days, no heavy exercise, and no intercourse for 2 days. That's about it. But again, people can go right back to work and back to their normal lives, which is really exciting. Some people who have very severe atrophy, so dryness of the tissue, we also can recommend supplements that you can use in between your treatments to help the tissue heal faster and help maintain your results. Then you come in whenever you need one for a touch-up. So younger women may not need one for a very long time. Postmenopausal women, maybe once a year, every 8 months, 15 months. Everybody's different, just when you start to see symptoms popping up again. And again, we can help support you with what you need in between that if that's necessary. So I've done enough talking. Now we're going to start our interview. And again, we have Miss Lisa DeLacy here, 59 years old. She's had 2 vaginal births, so she's going to share her experience with this. And we have Kristen Crawford, 38 years old, same thing, 2 vaginal births in her 20s, and she will share her experience. So let's start with you, Kristen. Please describe a little bit about your background, which led to your symptoms, and what made you decide, I think I need a diva?
For me, it started probably about a year and a half ago. I was in my dance class, and I was starting to have leakage while I was dancing.
Oh.
Yeah. And that, yeah, I think we've all...
Leakage.
Like
just...
Yeah.
Okay. Just clarifying.
You know what I mean.
We have more leakages when we get older. So.
Perfect.
Okay.
Great. Not anymore. Not for me. Now that I've had diva.
Right.
I'm like, okay, I can't get through my dance class anymore. You know, it's a high cardio dance class, and I'm like peeing my pants a little bit. This is great. Yeah, and I've had 2 babies.
Right. What did you go through childbirth? What was your, any issues you had afterwards?
After childbirth, as far as like,
tearing.
Oh my gosh. Oh yeah. So I had a pretty significant tearing, and sex after was always painful. I was super dry for, it seems like, the last 12 years. I've had to use some type of lubricant.
And she's young.
And I'm 38, so the last 12 years I couldn't get away without it. And then the leakage just started a year and a half ago. It's like, great, perfect. Okay, come on, 4 days.
Yeah, right.
Here we go. So yeah, when this came along, I was like, sign me up. Please sign me up.
Definitely.
And I hope, it's like, does it work? Yeah, it works. It really works. It's amazing, as you know. But yeah, so that's what led, I had 2 pretty big sized babies, and so.
Awesome. Well, Lisa, if you don't mind sharing your story.
So yes, I'm 59 and I have 2 adult children. My history kind of goes back to at the age of 16 being diagnosed with endometriosis and struggling with that really until childbirth. I've always been active. I've always been very running, anything. So
I'm going to interrupt. This woman leads 20-mile hikes regularly, and she's impressive.
So leakage is important,
right? On a 20-mile hike.
Yeah.
Unless your team is called running down your legs, you probably want to find. So I think that the acceptance that I always had female problems became a taboo for me. Mm-hmm. Because I was in and out of hospitals with the endometriosis. They were constantly lasering out. So, 7 of those, to the point where they said, you can't have kids. Mm-hmm. Then they put me on Depo-Provera, which is a steroid that really actually puts everything on hold. Mm-hmm. So fast forward, great easy burst with the kids because I was active. But didn't know much about menopause. And my mom had passed away of colon cancer when she was 43, so I'm just kind of navigating without any female history. And then the postmenopause, when I was about 50, ending 52, 53, my symptoms were horrible. I was experiencing hair loss. I was experiencing extreme pain during sex. I was extremely dry. My nails were dry, my everything. And I didn't know anything about the hormones playing into all this. I was too busy in life. So I am now on bioidentical hormones, and it's called the Wiley method. That has helped, but I still had the problem with the lubrication, etc. And so they put me on a DHEA suppository that I take every night. It is not romantic to have to navigate that around your sex life. So when I heard about this, I mean, I'm like the perfect candidate. And incontinence has been into play probably because of all the above, and I'm active. So between the two, what was more important for me was to be able to have a spontaneous sexual life with my husband. The kids are gone. We're supposed to, this is our golden years. But I wasn't able to enjoy it from a sexual standpoint. So this has been fantastic.
Awesome.
Yay.
Yeah.
Yay.
Yes.
That's so great.
It makes me so happy. How did, just describe, I mean, you both kind of touched on it, but how did these issues affect your quality of life as a woman and also in your relationships?
For me, I mean, the dancing, I mean, it's like night and day. The leakage part, that has been significantly improved. I mean,
Wow.
if for me, I couldn't go to the bathroom if for any reason, you needed to stop, or, is my kid calling me right now? Is that, you know what I mean, from the kitchen or whatever, and you kind of stop?
Right.
I couldn't stop if I wanted to before, you know what I mean? You would just pee your pants.
Right.
There's no stopping.
Yep.
And now it's like, you can stop.
Yep.
Or if I'm in a yoga pose or a stretching pose, and, before you're just like, you're going to pee my pants.
Right.
Now it's like, you can feel it. You can tighten up. It feels different.
If control.
It feels tighter,
Mm-hmm.
and the lubrication is like night and day after treatment 1.
Yeah.
It was like 50% improvement after treatment 1
Wow.
for me.
Yeah. No, I
mean,
felt the same way.
I mean, that's to not have to use anything after that. You know what I
Right.
mean? That's forever.
Yeah.
That's pretty.
That's our best friend.
Yeah, that's pretty incredible.
Because I think the whole part about, having an intimate sexual relationship is the spontaneity.
Right.
Especially us, we've almost been together 25 years.
Right.
I can't stand there and say, well, hold that thought. Got to put a suppository in.
Right.
So I think this has been really, for me as a woman who, at my age, my husband watches the Golf Channel, and all they do is talk about how to help men with all their sexual, or as they can't get it up. Yeah. So I'm watching commercial after commercial. Yeah. So we're very open in this world of advertising how to help men.
Right.
And I'm sitting there going, well, besides the commercials of the Massengale douche, I don't see much on the thing, on the TVs or anything that talk about this.
Right.
It's very hush-hush. And I talk to my friends about it, and that is one thing that is not discussed. Right. They just live with it.
Well, one of the main things when I was doing women's health solely was amazing to me. Women would come home and they just felt like this is part of life. You're told that this is just getting older or whatnot. And then all of a sudden, maybe they hadn't been sexually active with their partner for quite a while. Guy goes to get checked out by the doctor and comes home with his Viagra. Look what I got. And he's all excited. And she's like, oh my God. And I had this patient. I mean, I was early in my career, and I will never forget her. And she said, I was terrified of my husband all of a sudden. and she didn't say anything and didn't want to burst his bubble. So they tried to have sex, and she said it was like putting a hairbrush in me. And I was just sitting there like, what? And then patient after patient after patient described something like that. And that is so sad. You know, why can't they both enjoy each other, you know? And again, this is even on levels of beyond intercourse. There are women, I've worked in the ER, where they come in and they will have sepsis. They will have a systemic infection from their bladder as they age because things are so thin down there. They didn't even realize how sick they were. They didn't feel it. And, you know, and they hadn't been sexually active in years. So you can get these infections and all kinds of other problems that, you know, result in this. But, you know, again, like you said, you should be enjoying life, and this needs to be spoken about, you know, and no one should be embarrassed. This should not be something that people are hiding from because, and again, I'm sure most husbands or, you know, partners, no matter who they are, they don't want their partner uncomfortable. They'd be horrified to know that, you know, the woman's sitting there terrified and in pain, you know, I mean.
No, that's not, but
and many
it's
should know
not
about this
talked, but I think, April, the problem is it's not talked about because in my story, I did turn to gynecologists and doctors. And I did say, these are my symptoms. And I didn't get any answer that sufficed. I mean, I try really hard to not have to take a pill for every ailment. The men take a pill for their sexual. That's not the way we should be handling things. But I wasn't given any answers other than, well, you know, that's what happens. Yeah, you know, maybe you can go see. And so I think that is not okay, that we are all walking around with these symptoms and the information is not out there. That's why we hide.
Right.
Because then you think, oh, it must just be me.
Right.
And so no one talks about it. Your doctor's not offering up any information. And you're in a vicious circle and you give up. You just say, this is it. This is what I do. I have friends that are a decade older than me in their early 70s, and they haven't had any sort of sexual relationship with their husbands at this point. And I think that's sad. They love each other.
Right.
And they've come to that complacency of, it's okay. Right. So they're not, the men aren't, you know, being aggressive. They're just accepting.
Right.
And so that's not good.
Right.
Because relationships need the intimacy.
Definitely.
So at least I know I do.
Yeah.
Well, yeah.
Oh, make sure you take that piece up.
My husband
Turn the volume on.
He'll be like, just
funny. So it's working.
Yeah. Awesome.
Exactly.
Well, why don't you guys give your experiences during your treatments, and then what did you notice, or what was your post, you know, a few days after? What did you experience, Lisa?
You know, I have a high pain tolerance. I think a lot of women do, especially if you've had kids, maybe not. I don't know. So this procedure, to me, I walked in with zero expectations, more anticipation, but not any expectations because this is new. I'm excited. I feel like, you know, we're doing a clinical trial on this. And I didn't have anything. The first treatment was when I was done a little bit of awkwardness walking, and that was probably maybe in the first hour or two. And I felt like I got off a horse.
The numbing cream is
that what it is?
I think it's the numbing cream.
Oh, it's the numbing cream.
Good point.
Numbing cream feels kind of
It's like when you go to the dentist, you feel like you have a stroke, you know, whatnot. It
That's
just,
what it is.
things feel weird down there for an hour or so.
So,
So spotting?
just the first time.
Really? No
Yeah.
spotting the last two?
No, I don't. Well, I haven't.
Oh, today.
Today I could see. Yes.
But I mean, if I can share a little of your experience,
Sure.
you know, so that normally people obviously are starting off with difficulty the first time around. And so that spotting is a sign of that tissue, you know, being like, whoa, it woke up. And it makes me so happy as I'm completing these treatments. I look at the tissue and it's like, your tissue, you know, your vagina de-aged 30 years. Awesome.
Yeah.
And because there's not so much bleeding, you know, that means the tissue is much healthier and much thicker. And that's basically what we're shooting for. So.
That's great.
What about you, Kristen?
It was a little ouchy for me. I think I thought I was tough, and I think I lost that toughness.
It's
For
probably
me, it
the
was-
end.
Well, at the end,
for me,
at the end,
that
because you have scar tissue.
it feels like a rock tumbler in there,
Yeah.
right, for the incontinence part. That's
Yeah.
what it feels like. And then right at the very end, but for me, because I tore significantly. It's always
Yeah,
been
yeah.
really, really sensitive.
Yeah.
And then, but now it's like there's no pain.
That's nice.
With intercourse, there's no pain.
Yeah.
And that's been for years, over 10 years. Well, no, 15 years since my first son. So that's pretty incredible. You know what I mean?
Yeah, for sure. And basically, would you recommend this to your friends?
I already
Yes.
am.
Okay. Don't speak all at once. So. Awesome, good. Anything else you guys want to say about this, to share this with women?
Well, first of all, I would want to say thank you.
Yes.
Because
Thank you.
this, I really was going to the direction of just staying on the path of this is it. I was doing the suppository. My menopause symptoms went away as my estrogen, with the bioidentical. But it wasn't fixing everything.
Right.
And so I think that it was a godsend that this happened, that you happened to decide to do this. And I think that's what is so wonderful about this place is, we're not going to just be able to feel confident that we can look beautiful and feel more confident, but you're helping us internally. And that is priceless. And I know it's hard for men to understand because we don't have a good way of communicating an uncomfortable and painful feeling. And we just assume they can't understand because of the way we're built. And that's okay. But if I can have something to move forward towards and say, but we can move towards a better, sexual life, etc. It's an answer. It's not just this, well, we got to change that. Yeah. And I think that's it. So thank you.
Yeah.
I'm definitely an advocate, and I'm hoping that not just doctors you can put this out to doctors. They need to be the ones that are saying there is other options, and I'm concerned maybe that's not out there. It is a new one.
Yeah.
This is very new.
Right.
It's a very new concept. So hopefully, we want to get everybody in here.
Yeah.
No more suffering.
The older technologies, there, have been things out there for years that are more for the superficial layers, which it helps dryness, but they haven't been home runs. And again, the Diva is the first and world's only hybrid fractional laser. So it uses, not to get too geeky, 2 wavelengths to get deep and superficial. And with that, you're actually addressing all these issues, kind of from start to finish. And I'm over the moon, basically seeing your stories and to be able to help people is just life-changing, I think. So, well, please give us a call at Pacific Coast Aesthetics, and don't hesitate to have a complimentary consultation. Again, everything is private, and we'll make sure you're a good candidate. Like I said, I would say 80% of women are really good candidates and can be helped by this. But again, this can be a life-changing procedure for you for a multitude of reasons, as you heard today. So give us a call, and please like us and share this if you can. Please help all women. And make a comment down below about your thoughts, because we do pay attention to that and want to provide more information for you. Thanks again. Thanks, guys.
Thank you.